is specific to a diabetic personal electronic health record management. And the purpose, when we started our journey from the last year 2011 participation, where one of the biggest epidemic, as you can see in our country, is lack of structured data. We do have data available, but it's not structured, where we cannot make decisions, the right decisions, so that we could improve on it. And the continuum of care, and especially in the diabetic management, we need the continuum of care for the patient to benefit from and over a period of time. And one of the other reasons was the National Accreditation Board for Hospitals and Healthcare Providers. They are promoting guidelines for clinics and hospitals on how to manage a patient record and to obviously to bless clinical practice in a consistent and integrated way. And one of the other reasons was we have doctors where the patient volume increases over a period of time. So how do you provide the same level of care that you provide today when the increased patient volume that you receive in your clinic? And stemmed out of all this, we launched the Aayuwiz initiative. And some of the clear benefits that you could avail out of Aayuwiz is proactive patient reminders. Today in a chronic world, everyone is connected. You do have mobile phones that all the patients are connected with. How do you manage the disease condition? When something happens to a patient, how does a patient really get a proactive reminder? If a patient wants to communicate something, their daily monitoring of their blood glucose or anything, how do they get back to you? So proactive patient reminders, rapid and remote access to patient information. Patients are really busy. They want to really get the information really quick from you. You know, where we stand, what happened to the last visit, how do you get rapid access? Take advantage of some of the government initiatives that would be launched pretty soon with the Aadhaar coming. How do you collect your patient data and how do you correlate and take advantage of some of the government initiatives that are going to be put out there? Demonstrable high quality care, fewer repetitive and tedious tasks, improved continuity of care on chronic diseases and the best clinical practice in a consistent and integrated way. Some of the reporting benefits, today the doctor is really busy. There are a lot of patients and patients need time. Everyone wants time from a doctor so that they can explain what it is and listen to them. So with all that, with the time getting delayed, how do you improve? What are all the reports that you could generate out of the system so that you can give the right care to the patient and be connected to the patient? Referrals analysis. You do referrals today between the doctors. You could analyze drugs prescribed to the patient. What are the drugs that are being prescribed to the patient? One can run reports on a weekly, monthly, or different basis. Patient did not return. There are a lot of patients in chronic management. It's very important that patient return back so that your treatment really takes effect on the patient. How do you monitor that? Patient cancellations, they do happen. Patient quality improvement. What is the drug effectiveness? And how do you do clinical collaboration? And for the lack of the slides, most of the slides that we saw out there were everything around American Diabetes Association or in China where they have a lot of data that they collect. But we believe if we start putting structured data in our country, we could do a much better job in terms of doing a clinical trial and coming out with drugs. Lab analysis reports, recruit patients for case studies. And some of the upcoming release benefits, you could network the doctors within the system. Patient data can be accessible from mobile. You could do an automated check for drug and allergy interactions. A lot of times, doctors, there's a patient coming for a year, you could end up giving a drug, and then it's a year past, and then, there are chances that you could prescribe the same drug, so the system could alert on drug and allergy interactions. Monitor patient drug usage. Doctors prescribe a drug. Is the patient really using that drug once he gets out of the clinic? How do you monitor that? Real-time blood pressure and blood glucose monitoring. As and when patients monitor that, how do you integrate it? You want to know as soon as they monitor it, it gets uploaded into the system so that you see a graph. If something was not right, you could alert them back, call them back saying that I prescribe you on this, used it for 2 weeks, but I see things are not improving or things are going back, so proactive reminder to the patients. In terms of architecture, how it works and how you run the application, you have a server, and then all the clinical staff that you have in your clinic would access the application, and it's also available on the cloud network, which means like you could take the data anywhere. Like right now you are sitting in a conference and you have one of your clinicians call you, from the clinic and say like, this patient is really doing bad, he's here and what do I want to do? You could just take your mobile phone, access the data, take a quick look at the history and suggest something. So you can't be outside, attending conferences or personal work, but still give the same utmost care that you would give while you are in the clinic. Some of the differentiators, there are a lot of softwares out there which can do the job, record the electronic patient record. Some of the differentiators are regional and local support. Now we are there with you, regionally and locally to support you. One of the challenges that we found with using the system was, how do you find individuals who could really understand what needs to be entered and then enter it into the system? So we have care associates who can assist you in doing the data entry. We will have remote support access. We'll do a 24/7 toll-free number support, there for support. Some of the platform benefits itself, you get a single pane view of patient data, so which means improved turnaround time for diagnosis. You could forecast the health, reveals the value to the patient. Some of the screenshots, as you see of the application itself, this is the patient registration screen, and I was pointing to the UID where you could capture that information and use that for other government initiatives that would come out. This is one of the patient wizard, as you could see, you have the complaint in DX, medical and surgical history, everything. This is a one-time record. The first time the patient comes, you capture all this information and it's stored. You could reuse it multiple times as the patient comes in. The medication screen. You have a clean view of how the medications are used, what was the dates that were started, when they were stopped, what were all the medications, and this is the real clear medication, current medication that the patient is using. And then the lab screen, saying you could report all the labs into it, input the data, and then I'm going a little bit fast. I see we need to get out for lunch, but this is the final dashboard view for the doctor. While all these activities that are happening outside, your room, where lab is entering data, where your receptionist is entering data, your medication or anything is in the past is being entered data, the doctor is sitting in the office having this dashboard view of data where everything is represented. In one snapshot, you have what are the current medications that are happening. Okay, I really want to see the trend. Now I've been prescribing this patient, on this drug. What is the real trend that's happening? What are all the lab work that happened and how the results are looking? You have the complete general history. Now, what is the family tree? What is the social history? What is the medical and surgical? Where you can just get to it from one screen, and then you have the final SOAP note. Use the SOAP note to capture what is the diagnosis, and then the doctor goes there and says, okay, based on all this, I infer this patient is doing so well or not well. I need to change this. Then you fix the next visit date. Then go into the prescription module, prescribe the medication, and then you're out. So this is a handy view of you could just go back to the history that's out there and make a very informed decision to the patient. And you might as well even give this to the patient and show them these are the benefits that you would get out of it, which really encourages the patient to say, this is how you're doing. This is great. And based on our market studies, we found out a visual representation of the data is a very good representation to show to a patient who's unaware of their condition, to show that this is how you're trending, and if you don't follow the medication and the exercise and the practice and management that we give, you may not be able to reach where you want to reach. So that's a good way of representing the graphical representation. And I will, coming to summarizing, Here are the doctors who really contributed and helped us to get this application in place. Dr. Paneer Selvam, who's a co-chairman Diabetes Association of India, Ramachandran Diabetes Hospital, and Dr. Kiran Garga from Hyderabad. And we also thank other doctors who really provided their support. We worked with a group of doctors, not just from urban places. It's district headquarters level, rural level, everywhere, and we understood all the pain points, and then we came up with this deliverable. Please visit us. We have a stall outside there. We could do a presentation. You could take a look at our product. You can go to this website. You could call it toll free. And if really someone wants to see the system in action, we talk about it. There are a lot of other systems out there. How is the system really being used? I really thank Dr. Kiran for graciously accepting for the doctors to come visit this clinic so that we can see the system in action. How are patients giving out the data? How is the receptionist collecting data? And how is Dr. Kiran really using this application in order to promote the well-being of a patient? And thanks for your time and attention.
Thank you.